Good morning, seniors and colleagues. First of all, I would like to thank AIOS for giving me this opportunity. My topic for study is to evaluate the association of DRIL with visual acuity in center involving diabetic macular edema. So first of all, what is DRIL? It is disorganization of the inner retinal layers, that is the horizontal extent in microns for which any boundaries between the ganglion cell inner plexiform layer complex, inner nuclear layer and outer plexiform layer could not be identified. So DRIL acts as a predictive biomarker, acts as a tools to enhance patient counseling, improve risk stratification, advance clinical management, influence selection of eyes for clinical studies targeting DME. So histologically, it actually represents disorganization or destruction of cells within the inner retinal layers, including bipolar, amacrine and horizontal cells, leading to disruption of pathways that transmit the visual information from photoreceptors to the ganglion cells. So my aim of study was to evaluate the association of disorganization of retinal inner layers with visual acuity and their corresponding changes with time. So objective was to check the extent of DRIL, to evaluate visual acuity at baseline, 4 months and 8 months follow-up, and to assess the association of DRIL with visual acuity. So it was a single center prospective observational study, 45 eyes of 34 different patients with center involving diabetic macular edema in a tertiary eye care center in Kolkata from December 2020 to July 2021. Inclusion criteria was diabetic macular edema and cases where all the data were available for baseline 4 months and 8 months. Exclusion criteria was any history of ocular surgery within 6 months of study or any other ocular comorbidities or if the data was not available. So proper history was taken and standard ophthalmic examinations were done, and at baseline 4 months and 8 months of follow-up, we checked for BCVA, OCT to check for the extent of DRIL, to assess the association of the DRIL with visual acuity and presence or absence of CNP areas in association with DRIL. So a total of 45 eyes were evaluated with mean age of 67.38. Female male was 10 and 35 and laterality was 28 right eyes and 17 left eye. So on baseline, the BCVA was around, mean BCVA was around 0.64. At DRIL, mean BCVA was mean DRIL was 575. At 4 months, mean BCVA 0.7 and DRIL increased to 690. So there was a decrease in BCVA corresponding to increase in the DRIL value. And at 8 months, there was decrease in the DRIL and corresponding there was improvement in the visual acuity seen. That has a significant p-value. And the percentage of the CNP area was present in 31 eyes out of 45. So the center involving DRIL is closely associated with visual acuity in center involving DME, and changes in DRIL extent correlates with changes in visual acuity. DRIL seems to be a good predictive biomarker for visual acuity outcome in center involving diabetic macular edema, and our results correlated well with the parent article of Jennifer K. et al., where for every 279 to 352 microns increase in DRIL, there was a corresponding decrease in BCVA by 1 line. So limitation is a small sample size and small duration of study, and other parameters like hyperreflective dots, SRF and intraretinal fluids, they should have been included, and subgroup analysis of association needs to be done, and correlation of OCT DRIL extent and CNP areas seen in the OCT could have been done. So conclusion is DRIL is a good predictive biomarker for visual acuity outcomes in center involving diabetic macular edema, and OCT evaluation is a must in DME for prognosis and counseling of visual outcome. Thank you.
So does it improve? The disruption improves with treatment?
The DRIL extent at times, no ma'am. Actually, it depends upon case to case, and there, if the DRIL extent increases, that corresponds with the worsening of visual acuity. Even though there was decrease in SRF or IRF, but if the DRIL was increasing in size, there was a corresponding decrease in visual acuity seen.
Yes, but in one of your slides, you showed that the DRIL extent decreased and the visual acuity improved. So what I was asking, yes, there is one. So I just wanted to know whether it is possible for a disorganization to recover.
Yes, ma'am. It can recover. DRIL can actually recover, but corresponding visual acuity changes can be seen along with it.
Okay.
So any relationship with HbA1c and the blood sugar level?
Ma'am, that
you have not
seen.
Okay, thank you.
Thank you.